article that I wrote in the 70s. And the name of that article is Community Health Nursing, What Is It? It was published in Nursing Outlook, and I remember writing part of it when I was out of the country doing a consultation in Chile, and I was in San Diego. And I had a little extra time because I got there earlier than they expected me. So I sat down and I put some thoughts together that had been brewing in my mind about what I thought was a situation in our country where public health nurses were so engaged in direct care activities that they didn't see the big picture, and they didn't have the broad population perspective, population focus that I felt was the heart of public health practice, and thus should be a good part of public health nursing practice. And I can recall at the time people thought I was nuts. It's not either or. We obviously in public health nursing do a lot of direct care, but that's not all we do, and we do it in a context. And it should be in focus. We should have the community in focus, and then target our efforts to subgroups that are in particular need, are particularly vulnerable. And so the idea of the population focus had not been it had not been an operative concept in my training in public health nursing. And I felt that it was something that needed to be focused upon and given much more attention, and it needed to be operationalized in meaningful ways by nurses who view themselves as public health professionals. It's amazing to me now, thinking it's been now about 30 years. And everybody thinks about this now who was in public health nursing. But at that time, it was not something that was given attention. So I'm very grateful that the process has evolved and people are much more thoughtful about what they're doing as they practice in the public health arena.